Hello, I'm Sherry Simmons, and I have the distinct pleasure today of introducing Kim Berry. She's RN, MSN, NEA, BC, and she is the Director of Quality and Patient Safety here at the Christ Hospital. And she's going to be describing for us and our class, Nursing 5340, about the patient safety initiative we have here at the Christ Hospital in Cincinnati, Ohio. The name of this program is Target Zero, and I give you Kim Berry.
Hi, my name is Kim Berry, and I am the Director of Quality and Patient Safety at the Christ Hospital. And safety starts with me. Target Zero is a collaborative that we have embarked in with the VHA and HPI to actually decrease and change our culture whenever it comes to safety. The Christ Hospital is in the greater Cincinnati area. We are a 555-bed tertiary care hospital with about 2,400 admissions every year, so we do have a serious population that we have to embark on. I say safety starts with me. I actually have every patient or person in onboarding say safety starts with me, because it's not all about me. It's about the safety and the culture in the organization. We do have two primary goals. One is to systematically change the culture, to develop behaviors that everybody can be held accountable to. It is a 2-year engagement with the VHA and HPI, but our other goal is to deliver a 50% reduction on safety events. We want to make sure that we get to Target Zero as quickly as possible. So it is a 3-step process. We set some expectations, we set some behaviors for leadership and staff. We develop a top 10 safety list, and the leaders actually have to carry the message. So the first year of the collaboration is developing those safety behaviors. Educate the staff and the medical staff, because we have to include those stakeholders too, as well as reinforcing and building that accountability. Starting at the top, it has to start with the board. So in November of 2010, we had HPI actually come into this classroom to discuss what this collaborative was all about. All the board members were present, as well as myself and the executive team. Then after that, everybody agreed, yes, this is something we want to do. So we took a trip to Indy and said, okay, let's figure out what we need to do to actually implement this. So we got all the tools. It's a lot of tools that you have to gather, and a lot of data and information that you have to analyze. So we figured we would do a gap analysis. We already had some great things going on here at Christ Hospital, so we thought, okay, this is the way we're going to focus here in the organization. So we did some rapid cycle PDSAs, and we decided, okay, what are our quick hits that we can actually do very quickly? What kind of policies do we have? And you'd be amazed at what you find when you start looking. We developed some processes as well as some education. We have some measurement. We do everything that is data analysis. We make sure that we have data to prove what it is that we're doing, and then develop some commitment tools. These are the leader behaviors. It took our leaders about 3 months to develop the behaviors. Safety is a core value here at Christ Hospital, and actually the staff had asked to have that incorporated into our core values, because it just used to be Excel. So now we added safety. Building that accountability. A leader in our organization is defined as anybody that does an appraisal. So anybody that does a performance appraisal is technically a leader in the organization. And how do we fix things? How do we make sure things are ready to be fixed? So on the right-hand side, we have a lot of tools that we've developed over time, as well as some red rules for patient safety. So the red rules will go into a little bit more detail about how do you comply or stop the line in the organization. This is our top 10 patient safety list. We thought, okay, there's a lot of things that could be on this list, but what do we truly want to make sure is available for our staff to say, okay, this is on the top 10 list. We want to really keep our eye out on these things. And our number one is communication. It usually comes down to communication between departments, between people. Just looking at the patient's name and date of birth, that's communication. Our CMS never events, things that should never ever happen in our organization. Medication management is a very complex process. How do you make sure that the patients are on the correct medications from the beginning of their stay all the way through to discharge into the next level of care? Are there any unexpected deaths? We hopefully don't have any of those. Again, the goal is Target Zero. Readmissions, falls, critical results. How about any occurrence reports that have occurred over the last 24 hours? Actively looking at your environment, making sure that there are no hazards that are going to be occurring, and looking at that electronic health record. We all thought the electronic health record was going to save us all, but it just caused some different challenges that we have throughout the organization. Comply or stop the line red rules. The goal was to be at 100% compliance with this. Every single patient that walks in the organization needs to be identified by name and date of birth. Not only is it a Joint Commission requirement, but it's also the right thing to do. Timeouts before procedures or surgeries. Every single patient that's getting ready to have a procedure should have a timeout. And again, medication safety. Leadership education, the executive team had to be educated, as well as our patient safety committee. That's a multidisciplinary committee in the organization. Management conference was educated of about 250 people, as well as the medical staff quality committee, and the medical executive committee. We reinforced the behaviors through some posters, so if you walk into certain leaders' offices, they're still hanging there today, as well as our top 10 list that were pushed out to the floors. And in the beginning I said we have an administrative phone call, and safety starts with me every single day. 365 days a year there is a daily safety call. What is it? It's a focused communication. It takes usually about 15 minutes. There's about 31 departments that actually participate in the safety call, and you're talking about things that happen in the last 24 hours and the previous 24 hours, or the next 24 hours. Our kickoff meeting was January 9th to actually say who, what, where, when, and why, how are we gonna do this? And then we began the actual first phone call was on February 7th of 2012. We have guidelines. As soon as that time hits 9 a.m., the time starts, the meeting starts, and we start working through the process. Everybody's focused, everybody's phones are on mute, everybody's not having conversations on the side, and if they are, it's stopped very quickly and people get the dirty looks. But they're also reporting guidelines. It's you announce your name, your department, no issues, none foreseen, or if you have any pending issues, or if there were an incident in your area over the last 24 hours. So you look back 24 hours for safety, and you say, are there any serious events in my area? Are there any injuries to patients? Did anybody die? Are there any assaults? Is there any equipment or incidences that are occurring in your area? Did the electronic medical record go out over the last 24 hours? And then you look forward 24 hours. Procedures that may never have been done before. And you say, is there something that we need to make sure that the organization is aware of prior to doing the procedure in the organization? Any change in communication, any deficiencies in staffing that we might have. And every day you have a leader. The leader says, today's date is, my name is, and safety starts with me. It's at that personal level, so everybody is aware that it does start with you. It has been how many days? So we're up to 60 days since our last serious safety event. Are we on a surge? That's a huge impact in the organization. What does our census look like? People didn't know that before unless they opened up an email. Now we have that face-to-face communication. You have short-term follow-up, long-term follow-up, and then roll call. There are 31 directors and or managers that sit in on the phone call, and the leader goes through the roll call and says, nursing supervisor, and she will say, my name is, no issues, none foreseen, or she will give her issues. And we go down all the way through the 31 directors. Again, it takes about 15 minutes. Then at the end, we rotate through a 2-minute report. So each of those 31 people on that list gives a 2-minute report. So every 31 days, somebody's giving a 2-minute report on their area of safety concerns and or actually opportunities for improvement. So they give that 2-minute report, and it is an overview of the last 30 days and or the next 30 days based on the order of roll call. We do it on the weekends. We do it on holidays. So 365 days a year we have the communication. Safety behavior recommendations from HPI and VHA is to pay attention to detail. That's what Target Zero is all about. Clear communication, having that questioning attitude, and being accountable. Sometimes that's the hardest piece to do, is having that accountability. We also developed some commitment and tools for the staff. We put it in the framework of the Institute of Medicine 6 Aims, which is safe, effective, efficient, equitable, patient-centered, and timely. And we have tools that were pushed out to the staff to actually help them with each of those categories. It was a mandatory education process. There's still some opportunity for improvement. It's just ingraining those behaviors in everybody in the organization, and it just takes time. We are data-driven. Our organization is very data-driven. We wanted to see if it was actually